Welcome. Welcome to this weekly series on Fridays to address the mental health crisis we are experiencing today as a result of mental pathology in politics. I am Dr. Bandy Lee, forensic and social psychiatrist, president of the World Mental Health Coalition, and convener of the 2017 Yale conference that led to the New York Times bestseller, The Dangerous Case of Donald Trump, 27 psychiatrists and mental health experts assess a president. My colleagues, including some of the most eminent colleagues in my field, and I decided to come forward in unprecedented ways because of the unprecedented dangers that we saw and the critical need for our expertise. But we were also silenced in unprecedented ways because, like in all authoritarian times, truth, which empowers the public, had become a threat. And that the silencing, the dangers could only spread, as illustrated in my latest book, The Psychology of Trump Contagion, an existential danger to American democracy and all humankind. Now, we are trying to rectify this vacuum of the most relevant and rigorous expertise through a new book and a major all-day conference at the National Press Club, which I hope you will support. In fact, we need your support to make this a major influential event that will inform voters as well as protect them beyond the election. So please visit the explanation at the bottom of this video as well as in my newsletters. Now, the reason I stated since the very beginning that Donald Trump was not a problem of individual mental health, but one of a danger to public health, since my introduction to the dangerous case of Donald Trump, was because I was concerned about the spread of his symptoms, which I've come to call Trump contagion. Now, today I thought I would speak about Trump supporters, the other side of Trump contagion. Since my coming public with my concerns about Donald Trump, I have been inundated with messages from the public, mostly of relief and gratitude for affirming their concerns that the public was already seeing. But I also received a barrage of emails from Trump supporters who were in distress, who were angry, asking how could I possibly speak so negatively about their chosen leader. And so at this time, I also received threatening messages, including death threats. Those I didn't respond to, but anyone who wrote to me with more than one line, I responded to by email, by calling them back, and tried to reach out to them as fellow human beings and fellow Americans. I shared with them my love for our country, my patriotism, as well as my faith in God, as often a fellow Christian. And I tried to explain to them that I was not trying to attack their chosen leader, the one that they felt affection for, but rather I was concerned about the dangerous psychological features I saw and felt that the public would need to be protected. And many of them listened. Some of them turned around and actually became my friend. And others, I don't feel I have influenced in their opinions in any way, but we had formed a human connection. In fact, when the prison reform project came up in Alabama, I got a license there and practiced as well as pursued this project. And in the evenings for several months, I hung out with Trump supporters, sharing meals with them, hanging out with them. And contrary to my initial fear that I might be shot at, They turned out to be the loveliest people I had ever met, who brought me food for Thanksgiving, who invited me to their churches, and in fact, um, were the most hospitable group that I've encountered because I was new to the neighborhood. Now, through the course of Donald Trump's presidency, this all has changed, of course, rather dramatically, in the same manner that I have seen change in those who join street gangs or criminal cults, in that soon they would adopt the leader's impaired psychology or symptoms as their own. And toward the end of Donald Trump's presidency, I could no longer form the kinds of exchanges or have the conversations that I had in the beginning of his presidency. So blinded were they by my gender and by my race, calling me by the C word and accusing me of being an agent of the Chinese Communist Party. My email and message system could serve as a laboratory of this gradual but dramatic change in the population. And even though I approached the issue as a scientist, wanting to know more about what people were thinking in order to practice effectively the public health intervention I felt I was doing, I was inevitably heartbroken and saddened by this change in what I considered a previously beautiful people, as well as country, and the damage it was doing to these people and the public in order to support the mental impairments of a now influential leader. So now my coming forward in the first place was because I felt summoned by the public. The morning after Donald Trump's election, I was contacted, inundated with phone calls, emails, and other messages because people were afraid of the violence that was to come. They knew me as a violence scholar. I was recently on the front page of the New York Times at that moment because of a prison reform project, and civil society members, patient advocacy groups, lawyers, students, and other members of the public thought to contact me as their response to what they saw was a potentially violent outcome of an election. And so I had to think to myself, if I had devoted my career to studying, predicting, and preventing violence, would I turn away in the face of perhaps the greatest violence we could ever face, including existential, dangerous violence? And so I started interviewing with the media. Well, I first came out with my conference, and that actually catapulted me to being interviewed by all media from around the world. At that point, I counted 50 countries on 5 continents, and then came out the New York Times bestseller, The Dangerous Case of Donald Trump. So at that time, I was continuing my interviews, and before the American Psychiatric Association came out with the New York Times denouncing us as being unethical, as violating their so-called Goldwater rule, when in fact we were trying to meet a superseding obligation affirmed by the Code of Ethics, the APA's Code of Ethics itself, that we have a responsibility to society, as we do to our patients. And safety of society, of course, supersedes any other etiquette to a public figure. Also, there was the Declaration of Geneva, which is a modification of the Hippocratic Oath, which applies to all health professionals in the world, in that we needed to, that either cooperation or silence in the face of a destructive regime was against the humanitarian goals of medicine. And this was instituted after the Nuremberg trials. So, but nevertheless, what I have called the American Psychiatric Association's disinformation campaign, because it was not based on science or even the consensus of the field, but rather was a misleading of the public to see conscientious mental health experts who were speaking up as armchair psychiatrists who were being unethical and being stating things that were not to be stated about a patient. Of course, we were never treating Donald Trump as a patient, but only trying to respond to the public health threat. And in this case, society is our patient. But it still gained hold, and I was blacked out of the major media. Producers continued to invite me. In fact, I counted over 70 invitations where I was invited to appear on a major news program. The car was prepared, and I was sometimes even transported to the studio until last minute it would be canceled, or even the segment would be recorded but not aired, to the result of 100% of my interviews not being aired. In fact, I was to be on the front cover of Haaretz magazine, which I was told was the Israeli equivalent of the New York Times magazine. And the reporter and photographer flew into New York, traveled up to Yale, where I was at the time, and performed their interview. When I expressed my concerns that their article may not be aired, they essentially laughed and said it was impossible. Well, in the end, it did not see the light of day, as well as a dozen other interviews from Haaretz, from the Haaretz newspaper, and also the New York Times deleted only my quotes about a dozen times, including in articles by senior, highly respected reporters who made my quotes the centerpiece of their article. So there was systematic exclusion. So following that, there has been an inundation of messages from the public. Where are the psychiatrists? Where are the psychologists? And we felt that we needed to respond in a certain way. And the opportunity came when the Mueller report came out. Special counsel Robert Mueller was to investigate Donald Trump's 2016 election and how the Russians interfered with it. He came out with a report that may not have been enough to indict a president at that time. The reason was because not because of absence of crime, but because a sitting president was said to be immune from prosecution. But at that time, that could not have been better data for us to do a fitness evaluation. A fitness test is a mental capacity evaluation that has nothing to do with diagnosis. It's a functional exam that does not require consent or a personal interview. And I should mention that nowadays, even diagnostic exams do not have personal interviews as mandatory because of the change in our diagnostic methods since 1980. We look more at objective behavior, the patterns of behavior over time, as well as collateral reports. And for functional tests, we rely highly on collateral interviews, reports of close associates and coworkers, which in this case we had an abundance of. close interactions with Donald Trump in the context of his functioning as president under sworn testimony. So in other words, we couldn't have better information, higher quality, and greater abundance of the information we needed for the fitness evaluation we wish to do as a pro bono service to the public in response to their unending requests. So we gathered a panel of independent, non-governmental, top mental health experts from around the country to perform this evaluation. And the end result was that he failed every criterion of mental fitness, a basic mental capacity to make rational decisions, and not to be a danger to the country. This means that he was not only unfit for the presidency, because the office of the presidency would have had more requirements to assess fitness, but that he was unfit for just about any job or any task that one could give him. In other words, he was lacking in the ability to take in information, to take in reality-based advice, to process that information, and to make rational decisions based on reality that he will not change in the next moment without reason, and that he would be able to consider consequences for. And he would not be independently dangerous, which on its own would make one unfit. So the results that were alarming were from the Mueller report's data alone. We did actually request or offer a personal interview to Mr. Trump, stating that if he disagreed with these results, he could offer himself in a personal interview within a certain period of time. The Secret Service even visited me after I made the request, after the panel made the request with my address. And so we know he received the request, but did not respond. And so we took that into consideration. Refusal of exams or non-response to requests for exams are also indicative of greater likelihood of unfitness. And so we proceeded with our conclusion, which we felt we had enough information for, and we made recommendations to Congress that he needed to be removed from access to nuclear weapons and removed from his military function, ability to command a powerful military. And these were our most urgent recommendations. We had others as well. But because of our lack of exposure to the public, the Congress members themselves could not do anything. They themselves told us in the very beginning, when we consulted with more than 50 members who had invited us to speak with them in private, that they were actually relying on us to educate the public medically so that they could intervene politically. This was for the 25th Amendment at the time, because Congress has the authority to form an other body if the cabinet did not respond. And so that was surprising to us, that they were relying on our public education. But indeed, in the absence of it, they could not respond to our assessment. So that was the year before the COVID-19 pandemic. In fact, the year of the pandemic that we did not realize was coming. And then in early 2020, the COVID-19 pandemic reached our shores, and we had published a prescription for survival at the time, highlighting the results of our fitness evaluation that he was deemed mentally unfit and that his mental incapacity would lead to vast unnecessary COVID-19 deaths. Of course, what came to pass was that despite our being a nation with the highest concentration of medical experts, the greatest wealth, the greatest concentration of technology, and the most powerful military, we still ended up becoming the epicenter of the COVID-19 pandemic with the greatest death toll in the world, and our prescription for survival not gaining ground. We could not stop any of the press conferences or the daily disinformation that was now to spread throughout the world and to become almost half of the world's source of disinformation. In other words, the rhetoric of Donald Trump. And so, in my view, the pandemic itself may have been stopped at the epidemic stage, as have all potential pandemics. And that is a result of Donald Trump's mental unfitness. Another sign of his unfitness was the 2020 election loss and his inability to accept the results, but the need to propagate the big lie that this election was stolen from him. Now, I've noted in the past that the inability to accept reality can sometimes result in violence, and the unprecedented violent insurrection against the U.S. Capitol on January 6, 2021, can be seen as a result of his mental unfitness and his inability to accept reality. He stated at that time that he summoned his followers, stating that it would be a wild event, and held a Save America rally right before the attack happened, that basically they were going to have to fight like hell or they will not have a country anymore. The end result was that thousands of his followers invaded the U.S. Capitol and injured 174 police officers and killed 4, and even came close to physically reaching Congress members whom they were vowing they were ready to kill, and the vice president whom they were ready to hang with a gallows prepared outside the Capitol. I had stated in my 2020 book, Profile of a Nation, Trump's Mind, America's Soul, a few months before the election, that Donald Trump was truly someone who would do anything, no matter how terrible and no matter how destructive, to stay in power. In fact, I also predicted that his presidency would not end with the loss of an election for his followers. And indeed, that is what has come to pass with their denial of his loss, as well as his third presidential bid, and many of his followers being unable to consider anyone other than he as a candidate. So after this most traumatic event, perhaps in the nation's history, our sense of security and civility were breached, but also our sense of our own unity and our identity. So my concern at this time is facing the next election, which will be coming up in 2 months. Are we in any better place today? Are we better prepared today to face what is to come? And I'm afraid the answer is no, because of Trump contagion, which has not been addressed, never been contained. We had warned that if Joe Biden did not address the mental health aspects of the problem Donald Trump was bringing to his presidency, that it will eventually not be contained. And that is the result, that Biden's focus on simple policy governing and reconciliation has turned out not to be sufficient. In fact, it has facilitated the spread of Trump contagion. So this coming September, a little more than a month before the election, we feel we have another opportune moment to educate the public and to prepare the current administration for the aftermath of the election, as well as to prepare her to win, obviously. So this coming September, a little more than a month before the election, we will hold an all-day major conference on the more dangerous case of Donald Trump, and fit leadership, and the need for fit leadership. We feel we have a narrow window where we have a newly energized presidential election campaign, which is lifting us out of hopelessness, will enable us to face this an issue that has been looming over us, that had at one point been predictable and preventable, but now is overwhelming to the point of being difficult to address. But we will have another opportunity to properly address it and to try to contain it. Questions that still need to be answered include: how did we come to allow an unfit person into the office of the US presidency? How can we prevent this in the future? How did we come to allow a person who violently incited an insurrection against the government and is now running again for a top position in that same government? We predicted all this, which is why the year before the 2020 election, we organized a major conference at the National Press Club in Washington, D.C. The Dangerous State of the World and the Need for Fit Leadership conference was considered important enough that C-SPAN covered all 3 hours of it. And the top experts of multiple fields all gathered in one place. They're all 13 of them, which included fields of not just psychiatry and social psychology, but the law, political science, economics, history, journalism, nuclear science, and climate science. They had all joined us to emphasize the importance of fit leadership. And at this even more critical time, when there's potential for us to have even greater impact, we need to make this a significant live event in Washington, D.C., as well as online throughout the country. And to do so, we will need to get professionals to work on it with us, to prepare it, widely publicize it, broadcast it, as well as get C-SPAN to cover it again, and also to make it a major and newsworthy event. We will try to have Congress members attending it again, as well as major media attending it and covering it. The single theme of the conference will be that Donald Trump absolutely must be kept from entering the Oval Office again, and that the 3 criminal trials must all proceed to conclusion. This conference will only be worth doing if we have the kind of influence we need to have, and it can be done in this major way and become widely known. An individual donor has been generous enough to give us the starting money to be able to even conceive of this, and a gracious volunteer has started for us a GoFundMe campaign, which I'm happy to announce has superseded half of the amount that we had as our goal, and I hope you will help us to achieve our goal. So you can visit the site at the bottom of this video or in any of my newsletters.